Well, hello again, everybody. Welcome into another Keep Boone Healthy Community Information Channel report here on the 25th of October here in 2021. I'm David Jackson, President and CEO of the Boone Area Chamber of Commerce. We've got our vaccine friends with us once again. Jennifer Greene, Director of Public Health for AppHealthCare. Sean Burroughs is the Director of Pharmacy for Appalachian Regional Healthcare System. And we have Spencer Hodges in the act right now. He is actually working a vaccine booster clinic for Boone Drugs. So a man on the street as it is, to add to our reporting on this community conversation here today. So Spencer, thank you for joining us too. Let's start first with Jennifer. If you want to give us, Jen, a just kind of state of how things are in the community as it relates to COVID and the numbers and where you see trends at this point in time.
Well, the good news, David, is that we're starting to trend down with our cases. I believe that a big part of that is because we've had continued commitment to prevention measures. And one of the most important ones is getting people vaccinated. So as we see more people get vaccinated, I do believe that's impacting our community transmission. We are at 53% fully vaccinated in our community and 57% partially vaccinated. So we want to get that number higher, and I know we can. All of us who are, tired of COVID, I think it's really important to know that we're starting to see case trends going downward. That's positive news. So we need to hold on a little bit longer, continue to talk to our friends and family about getting vaccinated if they haven't been. And of course, stay tuned about all the booster conversations and kids who are going to be eligible to be vaccinated soon.
Well, we'll get into some booster conversation here in just a few minutes. Jen, one more question for you as it relates to state trends and some of the language that we've heard out of Raleigh, looking at high transmission, moderate transmission, that kind of thing. Are you seeing any movement in other areas of the state that would suggest that while things may be trending in the right direction here in Watauga County and the high country, are other areas following suit with that as well?
I think we're all seeing improvements in our numbers. The last I looked, we're still in an area of high transmission. So we're not quite in a mode where we want to be yet, but each week we're seeing decreasing trends. So that's a reason to be hopeful. And I think what we're seeing is that similar trend across the state. So we just need to hold on a little bit longer because I think we're going to start seeing us get to a lower level of transmission soon.
So Sean Burroughs from Appalachian Regional Healthcare System has always been good to kind of update us on what the scene is at Watauga Medical Center, understanding that that's the primary healthcare facility for numerous counties up here in the high country. Sean, what's it been like in the hospital in terms of COVID patients and some of those numbers as you share them with us regularly?
Yeah, we've come off our peak, what we had a month or so ago, where we were seeing, about 20 folks in the hospital at a given time, 18 to 20. And now we're down to between probably 12 and 14. So we're down a little bit, which is definitely a good thing. And as we're going to discuss a little bit about the boosters, we have seen some breakthrough infections. So the booster timing is really good to help prevent some of the breakthrough infections that we've seen. But the narrative hasn't changed in that the sickest folks that we see and those that end up not making it are the unvaccinated folks. So we've had 72 folks that have passed away at our hospital, and 66 of them have been unvaccinated. So that's the number that really rings loudest as far as the reason to get vaccinated. It may not prevent everyone from coming down with the virus, but it does a great job at preventing them from coming into the hospital and being put on a ventilator and not getting out.
Sean, I know that you just hit on a key phrase there, and that's that kind of that timing of needing boosters. We have seen vaccines in our community since back around the start of the first of the year, right there in January, and maybe a little bit earlier for some healthcare workers that were able to get access to those vaccines. But with that said, as we get a little bit more farther removed from those first shots for people or getting through the second shot and being fully vaccinated, what is the CDC guidance on timing right now, and how many people are indeed eligible for those boosters that may want one at this point in time?
Well, I actually did read those numbers. I can't remember how many millions of folks are eligible now, but anybody that's received Pfizer and Moderna, the messenger RNA vaccines, and it's been 6 months since their second dose. So I guess we're looking at sometime mid to late April for their second dose. Anybody that received their second dose before that of either of those two vaccines, the Moderna or Pfizer, are eligible to get a booster. And anybody that received the Johnson & Johnson at least 2 months ago is also eligible to get a booster at this point in time. And now if we're talking about the booster shots, the data seems to indicate that the booster with either Moderna or Pfizer is preferable at this point in time than to have a second shot or a booster of Johnson & Johnson. There's still more studies that need to be done and more evidence that needs to come out. But at this point in time, if someone's looking to get a booster vaccine, Moderna and Pfizer seem to have a little bit better data on them right now.
And that brings one other question for you here today. There was so much rigidity with this back when it first started that, you couldn't cross the streams, to borrow the Ghostbusters terms there, that if you had the Pfizer, you stuck with the Pfizer, and Moderna, same thing. What is it now about research that has allowed for there to be some of the mix and matching that we have heard about? And is that something that we should expect to see deployed in this area?
First of all, great Ghostbuster reference. That was fantastic, David. Secondly, there just wasn't a lot of data out. There were some studies that were done over in Europe about mixing and matching, but there wasn't a significant amount of data that was available to say, yes, you can get one shot of one and then another shot of another in your primary series. Well, as more time has passed and the boosters have come out and have been studied a little bit more, now they feel, the CDC and the FDA feel that it's okay, specifically after you've had your primary series and have built up the immunity with one of the lines, whether it's Pfizer or Moderna or Johnson & Johnson, going ahead and, as you said, crossing the streams or going to a different line seems to be just as effective. And if you got Johnson & Johnson initially, it seems to be more effective to get a messenger RNA molecule with your booster. So I think it's just a matter of there's been more time to be able to study the boosters, and now they're saying that it's at least as effective if you cross over from Johnson & Johnson to a messenger RNA, or continue with a messenger RNA if you got Pfizer or Moderna initially.
Spencer, you have been, along with your colleagues at Boone Drug, certainly providing first dose vaccines to a number of people, still administering boosters as well. Have you heard much, or can you share much about what some of the side effects have been from boosters? Is something that people should expect to see similarly to what they experience with their first and second doses, or are you seeing anything additional out of that may be helpful to share?
It's really, it's been all over the board. From what I can tell, I've heard many anecdotal scenarios where folks really haven't experienced much of anything. Personally, I had mine on Saturday, and it was sort of a repeat of dose 2 for me. Soreness, body aches, chilling, those type side effects. Nothing that didn't, just go away after about 24 hours, but a lot of folks say I didn't feel anything, and it may be contributed to that half dose, especially if someone's immune system is not quite as robust when they do get that booster shot. They may not experience those side effects like one who maybe had some extra antibodies floating around, so to speak, or a stronger immune response before they got the booster and then get the booster, so their body kind of precipitates out those, usual side effects that you would imagine from dose 2.
Spencer, I know that you all have still been, as I mentioned a moment ago, administering some first doses to folks. What is the general sentiment about folks that are coming in now? What are some of those driving forces you think behind them choosing to get the vaccine? Is it trying to get around family members for the holidays? Is it, having enough time to process the information that's been out there? What have you heard in that regard?
Yeah, I think it's a mixture of a lot of things. I think a lot of folks are just deciding that it's something that they want to do, and have done the reading and research over the past months, and acknowledge that the vaccine is safe and effective, and it's time for them to get it. maybe they had COVID back during the initial rollout, and so it's something that they've held off with until a few months went by, and then they went ahead and got their vaccine. So that's the general consensus from what I can tell.
Spencer, one last question for you, and we'll start around the horn on this one. I know that Boone Drug remains active in getting COVID shots out to folks. Can you tell us a little bit about how people can still get their shots from you all, what that process looks like, and is that the same for people that want to schedule boosters with you as well? And then we'll get the perspective from the hospital system and the health department on that also.
Yeah, our webpage is our hub for onboarding people into getting their vaccine. I think a real advantage, though, to coming to Boone Drug is that ability just to call up, talk to somebody in person, and say, hey, I need a booster, and they help you walk through that process or sign you up. So right now we are kind of appointment based just because of the volume, and that just helps our staff be able to plan accordingly with what we have now. If somebody were to walk in and need one, certainly that's something we want to try to accommodate. But when we do the appointments, we have a good basis for, what we're going to be up against, that week. I think today, going through the numbers yesterday, we have a couple hundred on the schedule for today, and that's for all of our locations. So I'm looking for today to probably be a 250, 300 day in terms of COVID vaccines across all the locations. And we're just trying to get those out as fast as possible. So we're, staffing accordingly as best as we can with the folks that we have. And then just trying to just be as open as we can for the community to get those.
Well, that's great. That sounds like great numbers there. So thank you for the work that you all continue to do. Sean, we'll ask you the same question. How can people best get scheduled up with either the hospital system providers or anybody else that's coming under the ARHS umbrella?
So we have booster doses available at App Family over at Boone Point, and we also have doses available at Baker Center out at Cannon, out in Avery. So those are our two community hubs. We haven't started vaccinating internally at the hospital for staff and volunteers yet. We're planning on getting through our flu vaccine clinics that we have going on right now and potentially starting that next week. But from a community perspective, we're trying to start the booster doses today at those two locations. But I imagine that certainly by Wednesday we'll be up and running with those. And those are also appointment based, which you can do by either calling either location, App Family or the Baker Center, or go online and do it that way.
I'm glad you said the words flu shot. I think a common question that people have is how does the flu shot work with COVID vaccines? Do I need to get one and not the other? What is your recommendation for people that are at this time of year starting to roll up their sleeves for that very important piece of our winter and early spring health?
Yeah, originally when the vaccines just came out, they wanted a 2-week buffer around the COVID vaccines because they were unsure how they would interact with different vaccines. But that recommendation has changed, and now you can get the flu vaccine and the COVID vaccine on the same day. You would just get them in separate arms.
Wow, that's like harkens us back to vaccination days back getting ready for school when we were little kids, just like shoot me as many times as you can in this one visit. So, well, thank you for that clarification. I'm sure that's got people awfully excited to go visit their provider, and they know they can get 2 shots of the same visit. Jen, we'll ask you a couple series of questions here. First off, the health department schedule around not only vaccines and boosters, but testing as well, because I know you guys are still involved with that.
We are still testing Monday through Friday from 8:30 to 10. It's drive-up testing, no cost, and we offer rapid tests and PCR molecular tests. We are grateful that there's so many other testing options available now. So still welcome folks to come and get tested if they need us. And then for vaccines, every afternoon we're offering vaccines from 1 to 4. We are giving people an opportunity to walk in if it's their first dose or their second dose. If they're trying to get initially vaccinated, we want you to come in and, of course, use us if you can come in and do that with very little planning, we're happy to take you. We also are doing appointments for booster vaccines. So you can call our number 828-795-1970. And our information's on our website at apphealthcare.com. But we're happy to get you in for your booster or your first dose if that's what you need. And also, I'm really happy that we have lots of options for people at our pharmacies and with other primary care providers like App Family, and I think that's a really good benefit. It's something I'm grateful to see at this point in the vaccination rollout stage.
Well, as we get ready to move into the winter months again, there's still an important group of folks that are unable to get vaccinated currently, but that may change with younger children. Jen, can you update us on where that is in terms of the process to get vaccines approved for certain age groups and what we can expect to see from a timeline perspective on when those may be available?
Yeah, so there's multiple steps in the process. The first is FDA committee really has a meeting and does a recommendation after review of the clinical trial data. We expect that to come this week. And then the next step will be the advisory committee for immunization practices. That's the group of independent providers across our country that advise CDC on immunizations. And they're going to be meeting again next, not this coming week, but the next week, November 2nd and 3rd. So it's coming around the corner pretty quickly. It's hard to believe we're talking about November, but we are. So I think in the next 2 weeks, you'll hear more about children aged 5 to 11 being eligible to be vaccinated with the Pfizer vaccine. Of course, there's lots of planning underway with partners in the community who are ready to help with that. And I think you can expect to hear more from Blue Ridge Pediatrics. You can expect to hear more from Watauga County Schools and how they're helping to plan for making vaccines accessible for our families who are ready to get their kids vaccinated.
Well, we will certainly keep all of you up to date on those proceedings as we hear that information here. We'll have another Keep Boone Healthy video that will come out as soon as that information is available with all of the players that Jen just mentioned there. I know that Blue Ridge Pediatrics has been involved in that conversation, Dr. Elliott with Watauga County Schools. So as soon as we can get that information, that timeline, and that rollout, if you will, all nailed down, we'll be back with you again to share that information to make sure that you know exactly when and where you can schedule those appointments for your kids if you want to go down that road. So Jen and Sean, thank you again so much for all of the information that you continue to share with us through this and many other platforms. I know Spencer had to duck back inside to continue his work today, but just remain very appreciative of your transparency and willingness to share information. And we hope to continue to see more improvement and more opportunity to get folks as healthy as possible as we get ready to head into the winter months here in the high country. So thanks for your time today.
Thanks, David.
Thanks, David.